This session is going to be based upon the BodyGuard 323 programmable pump. And the first thing that we're going to discuss is the titration mode. The second thing we'll discuss will be the continuous mode. These are the only two modes that we ever use essentially in a high-tech infusion service, and in particular intravenous immunoglobulin or IVIG. So what I'd like to do is show you on the board what the objective is as an example in the titration mode. Then we're going to come over and program the BodyGuard pump to reflect exactly what we have on our whiteboard. So let's start. So in the start mode, we're saying we want to titrate 3 steps. Here's step 1, step 2, and step 3. Step 1, we want to start out at 50 milliliters per hour for perhaps 30 minutes. And the volume we're going to infuse is 25. So if you're going to start out at 50 milliliters per hour, for example, and you're going to instill a volume of 25 ml, that's going to take 30 minutes. Then we're going to step it up to a volume, of a rate of 75 milliliters per hour, again for 30 minutes, and the volume that's going to go in is going to be 32 ml. The final step requires us to calculate if the first step is 25 ml, it's infused, and the second step is 32. You can see over here 32 and 25. So within an hour, we've infused 57 ml. What we're discussing here basically is we're assuming, for the sake of discussion, that it's 30 grams of IVIG that the patient is going to receive, and it's approximately 300 ml. So with the first 2 steps in, we know that that's 57 ml. But we need to calculate the remaining ml for the final step in step 3. So the volume is going to be equal to 243. And how do we arrive at that? It's simple mathematics. We know the first 2 steps will be 57. We subtract 57 from 300, and we get 243. And so this simple procedure is used no matter what pump you're using when you're going to be titrating. You need to calculate the final step, how many ml is going to go, will be infused into the patient. And that can vary depending upon, obviously, the number of grams that you're infusing. With IVIG, every 10 grams is 100 ml. That's a given. It's a 10% concentration. And so the total infusion time for this example is about 3.5 hours. All right, so let's just review this again. Step 1, we're going to start out at 50 ml per hour for a volume of 25. Step 2, it's going to be 75 ml per hour for a volume of 32. And the final step, step 3, is going to be the difference of the 300 and the 57. So it's going to give us 243, and that's approximately 2.4 hours. So the total infusion time is 3.5. Okay, so let's program the pump to model the titration rates that we have here. Okay, so there's 2 methodologies that can be used for infusing using an electronic infusion device such as the BodyGuard 323. One is a spike system, which requires a plastic device like this, and it's going to be connected directly to the bottle of fluid. Now, for the sake of discussion, we have a simulated 20 gram of IVIG, which is 200 ml. Actually, we have sterile water in here. But in any event, that's one methodology. The other methodology is the fluid is transferred into a bag using these transfer tubing. Again, you spike the bottle. You would spike the bottle, open up the air vent, and allow the fluid to transfer from the bottle into the bag. We're obviously not going to complete that step. We just want to show you the 2 methodologies. Once that takes place, you're going to disconnect the umbilical cord or the transfer set or the transfer tubing from the bag, and you're going to connect to the bag the tubing that's designed directly to be connected to the bag, and that's the BodyGuard 323 tubing. So there's 2 methods in which the tubing will be used. One, we're transferring fluid into the bag, and we're going to deliver the infusion via the pump through the bag. And the second methodology is when we're not using the bag, but we're connecting directly up to the bottle, we need the spike for the air vent so that air can get into the bottle and allow the fluid to move down the tubing as directed by the rate on the pump. Okay, so what we need to do is connect the tubing, and as you can see here, there's a little metal tab. We release that tab. There's a little this little black tab has to be connected with the connection like so. It will not fit in any other way, and then we can close the metal bracket. Okay. The on-off button, we'll depress the on-off button for about 5 seconds. Then we're going to depress the stop-no button, and we're going to hold this for about 10 seconds. And that's the key. When we depress the on-off, it powers up the BodyGuard 323, but it doesn't allow us to do any particular program mode. So to initiate the program mode, or to boot it up, if you want to put it another way, you must hold the stop no button for about 10 seconds. That will allow you to select the up-down arrow. It doesn't matter what program mode was previously there. In this case, it said 25 steps. Excuse me. What we're going to be using is we're going to duplicate the information that we have on the whiteboard. There's going to be 3 steps. So we're in a step mode, the 25-step mode. So we're going to say, okay. We could press the up or the down arrow. Let's just do that to show you. PCA mode, intermittent mode, TPN mode, continuous mode, 25-step mode. So the program cycles around the various modes that are available. There's only 2 modes that are going to be applicable for high-tech infusion services, certainly with critical health care, and that's IVIG, infusion therapy, to begin with. So we're going to select the 25-step mode, and we're going to say, okay. Okay, so 25 steps, and it comes up, you have to allow a few seconds for the actual step 1 to appear. Step 1, what's the rate going to be? Well, as you recall a moment ago, the rate is going to be 50 ml an hour, so we'll put in 50, and we'll say, okay. Step 1, we need to insert a volume, but again, we're starting out at 50 ml per hour. That's the rate. And then the volume we're going to infuse is 25 ml, so we'll insert 25, and then we're going to say, okay. It automatically comes up with step 2. So what's the next step? The next step is the rate is going to be 75 ml per hour, and we're going to say, okay. And the quantity of fluid that's going to be infused is going to be 32 milliliters. Okay. Step 3, what is the rate? Now we're at the terminal rate, and it will stay constant for that terminal rate until the infusion is complete. So the third step is going to be 100 cc an hour. Okay. And the volume, as we pointed out, we had to add the first step and the second step and subtract that from the total volume that's going to be infused. And as we showed on the whiteboard, that's going to be 243 ml. We're going to say, okay. Now notice it comes up with step 4. Well, there is no step 4 because we're only using 3 titration modes, or rather step 1, step 2, step 3. So when it comes up with step 4, the rate, you're going to simply insert 0 and then say, okay. Now the program knows that there is no step 4, or rather that step 4, there's not going to be any infusion. So it knows that the terminal step is going to be step 3. So there's going to be step 1, step 2, step 3. Step 4 has a value entered as 0. So the steps total is 3. The volume that's going to be infused is 300. And the total infusion time is going to run about 3.5 hours, 3 hours and 25 minutes. Now, the next thing that we would do is we would prime, use the orange prime or piggyback mode. We would press that, and then we would input a guesstimate of how much fluid is going to have to go through the tubing to reduce the air in the system. So I'm just going to guess prime about 8 ml. Oops, okay, prime, okay. Sorry, when you hit prime, you've got to hit okay, that's what you want to do. And prime volume, which comes up, we're going to say is 8, and we're going to say start, go. So right now what's happening is we're simulating fluid running from the tubing, from the bottle through the tubing, and coming out the termination. Okay, so theoretically, we've just primed the pump. Now, it may be that you guesstimate incorrectly for the amount of fluid that's required in the tubing. If you put in 6, you can infuse 6. You can always go back to prime again, and you can say okay. And if you need to put in 2 more ml to get the rest of the air out, you put in 2 ml, and you say okay. Okay. Now, we've primed the pump, we've programmed the pump, and now press OK to start. Start infusion, and we're going to say OK. Now, the reason why we're not starting is because we have air in the line. But that's the methodology that gets used to program the BodyGuard pump in the continuous, in the titration mode. If we're going to, I'm going to turn the pump off. Whenever you're not sure what the programming mechanism is going to be, you can always shut the program off, shut the pump off, and turn it back on. Okay? Hold the stop no button for about 10 seconds. Okay, until you see what was the last selected mode. Obviously, it was the 25-step mode. We used 3 steps to titrate. Now, if we wanted to infuse 300 ml at 100 ml an hour in a continuous mode, we can do that too by simply selecting the up or the down arrow. In this case, I selected the down arrow, continuous, and I'm going to say OK. Now the program is setting up. Continuous program, so milliliters per hour. Well, okay, we're doing that. We're going to infuse based on milliliters per hour. Okay. Now the rate that we want to run at is 100 ml an hour. For the sake of this discussion, we're going to say okay. And the volume that we want to infuse is 300. Okay. We've already demonstrated the priming function. So here it says CONT for continuous. The rate is 100 ml per hour. The volume is 300. The air sensor is on. Press OK to start. Start infusion. OK. Now the reason why it stopped is because there's actually no prime. There's no fluid in the prime itself. So that is the continuous mode, and that's the titration mode. If you want to program in a continuous mode and you want to use the titration step, then what we can do, we'll just shut the pump down, turn it back on, hold the stop no button for about 10 seconds. Key continues. Okay, now it says select program continues. That's the mode that we were in previous. So now I'm going to push the up button and 25 step, and I'm going to say OK. It's going to take a minute for the program to select that mode. 25 step program. OK. Now rate. Now you can use the continuous mode with a step 1 of 1 to accomplish the same function as the continuous mode. So the rate is going to be 100 ml an hour. OK. And the volume is going to be 300 ml. Okay. Step 2, there is no step 2. We only have one step. We're infusing 300 milliliters. We're running at 100 milliliters per hour. And so the rate for step 2 is going to be 0. Okay. And then the program comes back with a summary. Steps total 1. The volume is 300. The time is 3 hours. Press start to begin. So what we've just demonstrated, and we're going to say start infusion, question mark, okay. Okay. And again, the reason why we have the alert coming on is because there is no prime in the tubing. We're just simply showing the programming. If we want to stop, we can press the stop button, and it'll time out in 2 minutes, but we really don't need that. Anytime I'm going to change it, I just simply hold the on-off button for about 10 seconds and it's off. So these are the 2 programming modes that we're going to use. There's a titration mode, there's a continuous mode, and if you want, you're not even required to use the continuous mode. You can use the step 25 mode, and you can say step 1 of 1, identify the rate at which you're going to infuse, the total volume, then you say okay. Step 2 is 0. Anytime you're going to titrate, whether it's 3, 4, 5, 6, 7, or 8 steps, whatever it happens to be, the very last step in which you're not going to be programming or stepping, you simply enter the value 0. And then the program is identified. If I said there was 5 titration steps, then the 6th step would have the value 0. If I said there's going to be 3, as we demonstrated here, then the 4th step would have a value of 0. So effectively, we accomplish what we've demonstrated up here. We demonstrated the program in a titration mode starting out at 50 milliliters per hour, infusing 25. The computer calculates that and says it's going to take 30 minutes. Then we said step 2, we're going to program it at 75 milliliters per hour with a volume of 32. That's going to take 30 minutes. The program has already computed that. These two combined are going to take an hour. Then step 3, it's the last programming step. I want to run at 100 milliliters per hour, but I need to compute what the total volume is in the 3rd step. So just as a review, I add the first 2 up, and I subtract those from the total volume, and I get 243. So I'm going to enter a volume of 243. Then to step 4, as we show here, we're going to enter a value of 0. So it's a very, very simple device to use, the BodyGuard 323. The continuous mode, which I've illustrated here in blue, was simply saying, oh, we're going to start out, and the total volume that we're going to infuse is going to be 300 milliliters, based on this description of infusing 30 grams. And we'll start out, it'll be in a continuous mode, it'll be 100 milliliters per hour, as we've shown here in blue, and it'll be a total of 300 ml. So here again, you're looking at approximately, you're looking at 3 hours in one case, running at 100 milliliters an hour for 300 milliliters. That'll take about 3 hours. When you're titrating up like this, step 1, 2, and 3, it's going to take a little bit longer, or approximately 3.5 hours. So the BodyGuard 323 is a very nice device. It's very simple to use. The only thing the nurse has to remember is you're going to depress the gray on-off button to get the program started, and immediately depress the red button stop no for about 10 seconds. That allows the program to recycle around to whatever mode was being used before, and then it shows the up and the down arrows, which allows you to use the yellow up and down arrow to get or select the mode that you want to infuse. There's many more steps that could be utilized with the BodyGuard 323, but those are basically the 2 modes that we use. We're infusing IVIG or hydration fluid 99% of the time. Once in a while, we may be engaged with a patient that has Gaucher's disease, and we're using a lysosomal fluid, etc. But the programming steps and the methodology is the same. And again, by way of review, sometimes the pharmacy that we're servicing, they may want the spike system to be used. In that case, you're going to connect directly to the bottle. And you'll be switching from one bottle to the next until the infusion is complete. In other situations, the pharmacy may want to transfer all of the fluid to a bag, and then you would not require the spike system when you're infusing directly from the bag. Any questions that arise for any of our nurses, I'm available in the office. I can be reached at 631-473-4036 during normal business hours, Monday through Friday. If I'm not in the office, the girls in the office will relay any information or questions that you may have, and I'll be happy to respond to your questions regarding the BodyGuard 323. Any questions, don't hesitate to call, and we wish you the very best in your infusion service. Thank you.